So, we will be reading today about potassium. As you all know, potassium is a major intracellular cation. Okay, it's a major intracellular cation. So, 98% of potassium is intracellular, and 2% is extracellular. Okay, sorry, 2% is extracellular. Now, the third point is normally the level of potassium in blood is 3.5 to 5 milliequivalent per liter. Okay, it is 3.5 to 5 milliequivalent per liter. You should remember this thing that normally the level of potassium in blood is 3.5 to 5 milliequivalent per liter, while in intracellular compartment it is 150 milliequivalent per liter. Okay, so this is 150 milliequivalent per liter in intracellular and 3.5 in extracellular. These two things are most important thing to remember in potassium. Now the normal daily requirement, I have already told you normal daily requirement is 60 to 80 milliequivalent per day. So this is the normal daily requirement, which is 60 to 80 milliequivalent per day. And the next thing that you need to learn is how is the regulation? How is the regulation of potassium? It is regulated by basically renal excretion. Okay, renal excretion. What is the reason behind it? Because the filtered potassium is reabsorbed and potassium ion is excreted or secreted into the distal tubule. So renal excretion of So you have learned that the aldosterone is also responsible for excretion of the potassium. Third thing is metabolic alkalosis. What does metabolic alkalosis do? Metabolic alkalosis tries to retain the hydrogen ion in exchange of the potassium ion. So whenever there is metabolic alkalosis, it will be hypokalemic. It will always be associated with hypokalemia, and acidosis will be associated with hyperkalemia. Glucose and insulin. Glucose plus insulin. They push the potassium inside the cell. So they also cause, unlike sodium, what happens to potassium? Potassium is not completely reabsorbed. Then what happens? About 20% of the potassium is lost in urine every day. Okay, so patient on maintenance free fluid from potassium. Patient who are on maintenance therapy with fluid free of potassium, that is normal saline and all, these patients develop hypokalemia in due course. So potassium replacement is very important. Mostly after 2 to 3 days of surgery, potassium is replaced in form of potassium chloride, which comes in 10 ml ampule, 15% KCl, which you can give. Normal daily requirement is about 60 to 80 milliequivalent per day, and in each 10 ml ampule of 15% KCl, you will have 20 milliequivalent of potassium, so you can give 2 to 3 vials of potassium every day.